Thank you for taking the time to learn more about hemoglobin A1C. What is hemoglobin A1C? Hemoglobin A1C is also known as A1C or HbA1c. It is a blood test that measures your average blood sugar levels over the past 3 months. This is done by pricking the patient's finger and collecting a small sample of blood to put in an A1C generating machine. In a few minutes, the healthcare team can enlighten the patient with their different options for care based on this A1C reading. How does HbA1c affect us? When sugar enters your bloodstream, it attaches to hemoglobin, a protein in your red blood cells. Everyone has some amount of sugar attached to their hemoglobin, but people with higher blood sugar levels have more sugar in their bloodstream. The A1C test measures the percentage of your red blood cells that have sugar-coated hemoglobin. If your A1C is out of normal range at about 5.7 or higher, it is an indication of prediabetes. Prediabetes is a serious health condition where blood sugar levels are higher than normal, but not high enough yet to be diagnosed as a diabetic. Here, the patient is at increased risk of developing diabetes, heart disease, and stroke. A high A1C level is 6.5 and above. This is an indication of diabetes. Diabetes is a long-lasting health condition that affects how your body turns food into energy. The body either doesn't make enough insulin or can't use the insulin it makes as well as it should. Diabetes can lead to health problems such as heart disease, vision loss, and kidney disease. It is extremely important to reach and maintain your A1C goal to have a healthy lifestyle. There are many health complications associated with elevated A1C. The first is heart disease. Heart disease can be caused by having consistently high blood sugar that can damage blood vessels that control your heart. The next is kidney disease. Here, having consistently high blood glucose readings can damage blood vessels in the kidneys, causing them to work inefficiently. Next is nerve damage. Nerves can get damaged from having repeated high blood sugar readings. High blood sugar also weakens white blood cells that help fight infection, especially in the mouth. This can lead to a decrease in oral health. Furthermore, consistently high blood sugar can damage small blood vessels and nerves in the ear and retina, causing hearing loss and vision loss. Research has also shown that having uncontrolled diabetes can lead to a decrease in mental health, called diabetes distress. Everyone with elevated A1C have the ability to decrease it through some behavioral modifications. A few simple behavioral options to reduce one's A1C is by exercising and following the physical activity guidelines. Aim to exercise 30 minutes per day at least 5 times per week. Exercising helps the body use insulin more efficiently. Next, have a nutritional and well-balanced diet. Aim to decrease your consumption of sweet foods or beverages, shelf foods or foods in packaging, white breads and or other high carbohydrate foods that increase blood sugar. Instead, be sure to eat foods high in fiber, veggies, and small servings of meats or poultry. Understanding how to manage stress is extremely important because stress causes blood sugar levels to rise, which can lead to elevated A1C. Some ways to decrease the chances of having an elevated A1C is by spending time with the people you love, yoga, and even meditation. Lastly, be sure to take medications as prescribed by a physician and, of course, monitor blood sugar levels. Be sure to reach out to your healthcare professional for more information.